So in my practice, red eye greatly affects my patients. In fact, much more than I ever had anticipated. I used to think it was just part of natural irritation from mild conditions, and that it just, we'd overlook it many times. So we kind of knew it was there. Patients go to work or around friends, and they get self-conscious. They're wondering if people think they've been drinking or not sleeping well or crying. All of those are negative effects that they feel, and I think it keeps them from doing the normal social activities they do, from being out with family, from really living life. In my practice, I've discovered that over the years there are a number of reasons for minor eye irritations that lead to redness. And it's much more common than we ever thought. And I think probably the big reason why is the digital devices that are so prevalent. I don't think we had the issue, or maybe I wasn't looking for it, 15 or 20 years ago, but it just seems so prevalent today. We have people who are gamers, and we have people who spend their entire day on digital devices as part of their work requirements. We have people who go home and watch digital devices all the time or travel. So we have a lot of reasons for that minor irritation. I also think depending on where you live, like I live in Kentucky, we have a lot of mild allergy that occurs, and it may be enough to contribute. And then meibomian gland dysfunction, which occurs from contact lens wear, from digital devices, hormonal regulation. There's so many of those causes that contribute to this condition. Now, what's interesting is they're not fully aware. Some have heard about it and they come in. Some are excited about it, try it. But there's a large population still that when I introduce the product, get very excited. And then that's what's exciting about products like this and the impact they have on our patients. I also think it's very important that as eye doctors and colleagues, eye care practitioners, that we also realize that although Lumify is very effective as a redness reliever, we have to be cautious of the fact that if there is an underlying disease, such as allergic conjunctivitis or dry eye, meibomian gland dysfunction, that we're still treating that condition on its own. I think that's critical to the overall management of these patients. We want to ensure that not only are we helping them in terms of their confidence and the redness that they're concerned with and all the issues that go with that, but if there is an underlying cause of this minor irritation, that's being addressed by the physician as well. Some of the most common questions I receive from colleagues regarding the safety profile of Lumify redness reliever eye drops are related to, I think, their understanding of the product, brimonidine tartrate. They are questions like, does it affect intraocular pressure? And in the clinical trials, there was no statistical significant decrease or change in intraocular pressure in any of the patients in the trial. I get questions about pupil effects. And once again, in the clinical trials for Lumify redness reliever eye drops, there was no signs of patients, there was no measurement of patients having significant decrease or change in pupil size, increase or decrease. Another question that comes up a lot, might be the most common question I get, is the risk of an allergic reaction to Lumify. Once again, in the clinical trials, there was no mention or adverse event that showed an allergic reaction related to Lumify redness reliever eye drops. What excites me and differentiates Lumify redness reliever eye drops from other redness reliever products is its unique mechanism of action and its effectiveness. But for me, the things that separate low-dose brimonidine tartrate from other redness relievers is the mechanism specifically around the alpha-2 adrenergic receptor agonist. Previous redness reliever eye drops worked on the alpha-1 primarily, and some alpha-1 and alpha-2. And if you think about the mechanism, that involves the arteries. So the previous redness relievers would cause constriction of the arteries. And as you can imagine, constricting the arteries could lead to ischemia. It may lead to tachyphylaxis, where they lose effect as the body tries to fight that. When you have tachyphylaxis or loss of effect, then you have risks of overuse of the product, and even other things such as rebound hyperemia. When you have Lumify redness reliever eye drops, you're focusing now on the alpha-2 adrenergic receptor agonist. And there we're working primarily on the venule side. By causing constriction there, you get the effects that you want to see as far as the redness relief, but you also are keeping the arteries relatively where they should be, maintaining the artery flow, which is oxygen, allowing patients to have the response we need. The other aspect when it comes to Lumify redness reliever eye drops is the impact on the practice as well as the patient. But for me, I love the opportunity where I have a patient who complains of redness, being able to take a sample, put a drop in one eye. I like the contrast of the two for the patient. I wait about a minute and I bring out the mirror and I have them look, and the expressions on their face and the comments are dramatic.